Hello everyone. Welcome back to the OSMECON MedQuiz 2021. I hope you had a wonderful time taking part in the prelims yesterday. And today we are back with answers. I'm joining back live from hospital duty. And I think you have seen what I do on a general basis in the prelims as well. So for the prelims, to go through the answers, we have our veteran quiz master, Dr. Syed Mustafa Hashmi.
Welcome back, everyone. That was an exciting prelims. Not just because the questions were good, but because what happened with the technical glitches. It was quite a roller coaster ride. But life is all of uncertainties. So in our medical profession, we need to be ready with plan Bs and plan Cs. So I think things have worked out well. Let's go to the answers now. A word to our sponsors, Marrow and JP. Marrow, especially, as you know, is the gold standard for PG preparation for your exams entrances. They also have services for foreign medical graduates, super specialties, and all such. You can look at their website for more. Yeah, the amazing prizes. You have cash prizes, Marrow plans, JP book vouchers, goodies and certificates, and trophies also for the runners-up. The winners take home a cash prize of rupees 7,000 in 6 months, full Marrow subscription with videos, questions, bank, not JP book vouchers, special goodies, trophies, and certificates. Yeah, the special prizes for you have a cash prize, JP vouchers, goodies, and certificates. Prizes for the best all-girls team, for the best junior team, and the best team names. And the online quiz winners get a free basic registration to OSMECON's events. The total prizes being worth 1.5 lakhs. We're really happy to see a lot of all-girls team participate, more than 50 of them. A lot of junior teams participate, around 40 to 50 of them. So that's a very encouraging number. That bodes well for OSMECON's future as well, especially for the quiz. As for the team names, we have had plenty of interesting ones. You all know our surgery textbook, Bailey and Love. There was a team called Bailey and Friend Zone. I guess someone is having a rebound. There was a nice team name of a team with Midlife Crisis. And I think all of us know what that feels like, midlife crisis. There was a team called Beck and Curie. There was a team called Goal Diggers. And this was, interestingly, not an all-girls team, Goal Diggers. There was a team called Hashmi Brothers. And this was an all-girls team. Well, hard luck, girls. That will not get you the prize for the best team name. There was a team called the Best Team Name. These were smart people. If you can't win something, just copy. So they are called the best team name. So, they can always brag about it and just feel good about it. There was a team called Multiple Sclerosis. There was a team called Hippocratic Both. So both the people, I hope, were very honest in the quiz, Hippocratic Both. And the winning team name will be announced later. So with that, let's move ahead. The format, like you all know, was 25 questions, 31 points with no negatives anywhere. Let's go ahead. This is where things, really got tricky. We did not want anyone to Google, so we had a live quiz premiering. You were supposed to submit the form at the end. There were glitches with that. Some people could submit, some could not. Some got extra time, and we had teams complaining that this gives others chances to Google. But we had lots of inbuilt checks and balances for that. One, the questions were actually hard to Google. Some of them were too easy. You would have anyway got it with the clues I gave. So that didn't require Googling. The others would have, in fact, misled you, and that we actually saw happen in the quiz. In fact, I was speaking about how honesty is very important for building trust with the patients and not getting beaten up by them, for God's sake. I was talking about professional ethics and all of that in the quiz, but, I think it's somewhat like the way it happens in Palestine, where Israeli Zionist settlers just walk into a Palestinian home and just take over it. And when you ask them, they tell, if I don't steal it, someone else will. And that's a very shitty justification to give for, inhuman and anti-human practices. But that's the kind of thing, even really good teams who don't need to Google might really get jittery that if others are getting a chance to do it, then even we must. But then, we could really see through your Googling. Some questions, you would get the wrong answer by Googling. We ourselves did that in the quiz when we were making the questions. We could see some of the teams give those answers. 2 particular teams, I think 4 particular teams, had the same answers A to Z, 1 to 25, with the same wrong answers, with the same punctuation mistakes. So we can see through that. I mean, we are also quizzers, and it's like, fantastic teams, and where to find them? You cannot find them in online quizzes. I mean, even online quizzes, even good teams, they are forced sometimes, but we could see through it. The teams who had submitted answers both in the answers form and in the email, we could tally them and see where you were trying to be over smart. So all that was taken on. And guys, I mean, this really shows that honesty and integrity is when you don't cheat behind closed doors, when you don't be dishonest when no one is watching you. And I think that is really important. I mean, God is watching all of us, so we need to keep that in mind, all of us included. So yeah, with that out of the way, let's go ahead. We have changed the format a bit. I mean, we had tiebreakers, we had inbuilt questions, we had start questions, and all of that. Even after that, not the top 8 teams, but now the top 24 teams get a chance to be finalists. And this is how it will work. We had about 230 teams registering in the prelims. The top 4 teams, like you can see on the screen, get to the finals directly. These were really good. These teams had very good answers. Teams number 5 to 24, that is about 20 teams. 10 of them, even number teams, will be in semifinals A. The odd number teams will be in semifinals B, and the top 2 from each semifinals make it to the finals. So that will make 8 teams in the finals. The semifinals will be held at a time that will be announced today. The top teams will be called. All you teams, you will have to be available. If you're not, you give up your space for somebody else. So we can't really wait for others to have their time, have their convenience taken into account. Let's go ahead. We have a surprise for you in the finals. None other than Dr. Deepu Sebin, the CEO and co-founder of Marrow and Daily Rounds, is going to join us as the chief guest in the finals. It's an honor and privilege. We're really happy to announce before all of you that you will have Dr. Deepu joining us in the finals. We're looking forward to that, just as I guess all of you are. Coming to the answers, the very first question was about NASA building a particular facility with bedrooms, bathrooms, kitchens, labs, and even a gym, which was completely sealed from the outside air. Astronauts were made to stay here for facility. The question was, why were they made to stay here for 21 days? Those astronauts who went to the moon and got back, the answer, like most of you got it right, was to quarantine and isolate the astronauts. The idea was that, this is the first time man went to the moon. So what if some deadly microbes were brought back from the moon? So they were made to stay for 21 days. All their vitals were monitored, their symptoms were checked. Fortunately, all of them were healthy, and this safety valve kind of a precaution still exists. Question number 2, a photoplethysmogram shows changes in blood pressure, heart rate using a handy device, is what I said. The handy clue helped many of you. This is indeed a pulse oximeter. This particular meme was doing the rounds. These machines that flood the market can even give you the saturation of oxygen of a pen and a pencil and an eraser and whatnot. That's the kind of cheap materials that flood the market sometimes to take advantage. Question number 3 was this Telangana initiative called Medicines from the Sky. I said that our RT minister said that through this we can save lives. It helps transport vaccines and blood products by avoiding traffic from the sky. Like most of you got it, it's quite simple. This is the drones. You can see the emblem of the Telangana government on this drone box. So this was actually started by them. Then the next question number 4. What does SF stand for in some supplements and medications? That is indeed sugar-free. This is targeted at diabetic patients. Question number 5. If these are used in children, what is used for adults? And the clue I gave you was, this is right from our first year physiology. Some teams, actually give answers like tumbling E chart and Lee test chart. These kind of answers clearly tell that you were not listening to what I said. What is used for adults? If you don't know a Spellens chart, you need to really revisit your first year physiology and pass the exam again, honestly. Wrong answers to this one really shows you in a poor light. Next question. It's about how vitamins were earlier named vitamins because they were thought to be amines. Later it was discovered not all of them are amines. Currently only 5 vitamins actually have a primary amine group, that is an NH2 group. Vitamin B3, B6 and folic acid, there are 3 of them. What are the other 2? I said think of the words and not the structures. Most of you got this right. Thiamine and cyanocobalamin, B1 and B12. Question number 7. And yeah, I think all of you could really get the magic here, the magical number. That is the number of objects you can hold in your short-term memory, -2. The magic number that on your screen is number 7. And most of you got this right. So I hope you all were listening to what I was saying. Question number 8. Some of you who saw very carefully could actually see the word PET written on the panel B. So that would have given you a PET scan. But even then, PET scan, it uses FDG, fluorodeoxyglucose, the cancerous part. Cancer cells have a much higher metabolic rate. That's why they are shown up as bright spots. That's your PET scan in the middle. Part A, I told you to focus on the vertebra. A CT scan is basically an enhanced X-ray. You can think of it as very, very high resolution X-ray. So that's why the vertebra is quite bright here, whereas in an MRI, the soft tissues are enhanced, whereas the bone is not enhanced. So C is MRI, A is CT scan. That's CT, PET, and MRI. Question number 9. A commonly done practice with the belief that it reduces pain, but it is actually medically contraindicated. It alters the drug distribution in the desired layer. It interferes with drug absorption, and if done vigorously, can cause adverse local reactions and even affect the structural integrity of some drugs. Which practice is this? This is indeed rubbing the IM injection site. I want the complete answer. Rubbing the intramuscular, or at least rubbing the injection site, will give you full points. The clue I gave you was something that all of you would have experienced when you took the COVID vaccine. The nurse will tell you. Question number 10. These are automated equipments doing what vital but exhausting procedure? The answer is, let's look at the GIF. It's an automatic CPR machine. I have actually seen and used this in hospitals, and some teams who probably have not seen and used this could answer as Lucas CPR machine. If you guys actually know the brand names of different CPR machines, welcome you to come and host the quiz instead of me. You deserve to be the quiz masters. We can see through it. There was no way that quite a few teams could know Lucas as the company that made this particular machine. So, who are you fooling? Question number 11. Contrary to what some might mistakenly believe, this colored body was not named because it resembled the shape of an alphabet. But actually, the backstory is that in the 1890s, a German scientist was studying the gonads, the testicles of an insect, and he noticed that a particular entity was chained as easily as the others, but unlike them, it did not take part in meiosis. This led him to wonder if it was a different type of entity, not falling in sequence with the others, what got its name thus. And the answer is not Y chromosome, it's not a bar body, it is the X chromosome. So he had chromosomes 1 to the number of chromosomes in that particular insect. He noticed that there's a different chromosome that behaved differently, which did not really cross over as significantly as the others. He called it the X chromosome out of sequence. So that is the answer for this. No other answer accepted. Question number 12 was this particular popular optical illusion where the lines are actually parallel and you see gray dots when it's all plain white. So why does this happen? It's a particular property of our nervous system, which is the ability of neurons to, when they're excited, to reduce the activity of its neighbors, which can help us actually, have localization and even suppress our natural tinnitus in the ear. So this, I said, just think of the words, translate to medical language. Activity of neighbors is lateral cells. Suppressing or reduce the activity is inhibition. So it is called lateral inhibition, this particular property of our neurons. Question number 13. These are two explanations of what traditional method used by both doctors for a quick assessment and by laymen. The back of the hand is innervated by the radial nerve, which has a lot of spinal nerve roots, and the skin is actually thinner than the palm. The answer, and the only answer we accept, is checking temperature with the back of the hand. Some teams actually wrote checking temperatures with the palm of the hand. Guys, I want to meet your HODs and ask them what's happening in your clinical rounds. If you do that in the exam, you're sure to risk a serious damage to your scores. So yeah, checking temperatures with the back of the hand. If you write only the word temperature, that is not right. As medicals, you need to know how to present your answer. Just temperature will give you no temperature. Thermometer temperature, rectal temperature. Checking temperature with the back of the hand. So that should be described clearly for points. Otherwise, no points. Question number 14. Remove 14th question. Removing the numbers and one letter from COVID-19 will give you the name of a primary immunodeficiency disorder, which has low antibody levels. The name of this disease refers to the fact that it is the most frequently diagnosed primary immunodeficiency. and it has diverse clinical manifestations. A lifelong disease difficult to treat. Which disease this is? From COVID-19, remove 19. Remove the letter O, you have COVID, and most frequently diagnosed, so it is C for common. And diverse clinical manifestations, common, varied immunodeficiency. So it was quite crackable and guessable. So this is what OSMECON is about. To use the clues even in your clinical practice, in your postings, you have to see the patient, take a good history, take a do a good examination, pick all the clues you can and put them together and come to the answer, which is this is what we try to simulate through our quiz. Question number 15. This through teams of, all your Googling will not get you this answer, right? It's really hard to do it. So this is where we test good teams. Good teams got this, right? Some teams who struggled, were all over the place. We could see with their other answers. Yeah, so cholesteatoma does not have fat, and not a malignancy. Hay fever is not caused by hay, and it is not a fever. It is actually allergic rhinitis, so not necessarily by hay. Ligament of Treats is the suspensory ligament of duodenum, which is not a true ligament. It's not bone to bone. It is basically a fold of peritoneum that supports the duodenum. Mycosis fungoides is not a fungal infection, nothing to do with the mycosis. It is actually a cutaneous T-cell lymphoma. It's a cancer. Adenoma sebaceum is not adenomatous, nothing to do with adenomatous, any gland, not sebaceous glands. It is in fact an angiofibroma seen in tuberous sclerosis. Then Haemophilus influenzae was earlier thought to cause the influenza disease. It was found not to cause the disease, but they retained the name because once it is common, it's hard to change it. Then you have pyogenic granuloma left. It is not pyogenic, it's not an infection. It is not a true granuloma. In fact, it is essentially a capillary hemangioma that easily bleeds on touch. So what is left is yellow fever, which is actually not a misnomer. The yellow in the name refers to the jaundice, the yellowness seen in some patients. So only yellow fever gets you points. Any other answer you mention along with yellow fever, your entire answer will be marked as incorrect. Question number 16. Arrange in ascending order in an average human. Well, the number of points, like the number of bones, like most of is 206. The number of joints would obviously be more. Think of all your carpal joints, multiple joints in the skull and the vertebra. There are plenty of joints between both vertebrae. So that totals have to be around 360 or about 400, depending on how you count. And then you have about 900 ligaments, plenty of ligaments in your knee joint, in your ankle, all other joints in the body, especially your wrists and ankles. And then tendons is attaching muscles to bones. Each muscle has multiple tendons at times. So that is obviously the highest, around 4,000 tendons in the body. So it's BADC that will get your points. No other sequence will get your points. Question number 17. The WHO list of essential medicines is a compilation of essential drugs in a health system. The current list has about 470 medications. Only 2 of them are used in their pure elemental form, just the pure substance with no other compound in it. I gave you 2 clues. One is an essential therapy of the past 2 years, much in the news. The second one was something you would come across in your forensic medicine and toxicology textbook. The question that you simply cannot Google, because the way we framed this question, we had to download the list, study the list entirely, and then look at all the options and then do it. So this was essentially non-Googleable, so we could see which teams were genuine in their answers. The answer is first is carbon or activated charcoal. So all of the things are the answers like lithium. You cannot take ions. Ions are always used as compounds. So lithium carbonate and other compounds. Calcium is not used in the pure form. It is calcium carbonate. Iodine has potassium iodide as a mixture in Lugol's iodine. Iron is not taken elementally, though we call it elemental iron. It is ferrous sulfate. So all these things are elements, are compounds rather. Oxygen and carbon are in the pure form. Question number 18, the world's deadliest animals. First is, of course, the mosquito. Second, sometimes wrote the housefly. It is not the housefly. Like some of the teams here in the quiz have been dishonest. You have some ugly human beings who kill other human beings. So the number 1 spot goes to mosquitoes. Number 2 goes to human beings. The homicide rates worldwide are actually not insignificant. So that is, what gives you this list by the BBC and CNN. Question number 19. Let's go to the answers for this one. Human breast milk is actually not sterile. Inside, by the time it comes out, by good bacteria, lactobacillus and the like. And these bacteria that actually colonize the neonate's gut. So the neonate's gut flora is actually built by human breast milk. A healthy human's gut flora includes bacteria, fungi, and viruses. That is obvious because that is how you have opportunistic infections. When your immune system is weak, the fungi and viruses and even bacteria can overwhelm your immune system. So that is true. Statement 3, healthy human saliva does have antibacterial compounds and enzymes, but once it is in the oral cavity, it washes all the bacteria inside. So it has a lot of healthy bacteria as well, and also unhealthy bacteria that give you your halitosis or bad mouth odor. So question number 20, which COVID vaccine has been the most widely used? Well, India has done a fantastic job of vaccinating about 1 billion people, 100 crore people, though we are much behind our target of vaccinating all adults by the end of the year. Behind that, but yet it's commendable that we could do so much. But one country has done it much more than us, and that is China. So China's CoronaVac or Sinovac is the top used vaccine worldwide. China even exported this to many, many countries like Indonesia and a lot of African countries which have been using this. So CoronaVac takes the first space. Even Sinovac gives you points, but not Pfizer or Covishield or Sinopharm. Those are all wrong answers. Question number 21. When a doctor gives an intracaverous injection where drugs like alprostadil, papaverine, and so on are used, the injection is not given in your cavernous sinus. It is not given in, some teams wrote bulbocavernous. I don't know if it exists in your body. It doesn't exist in the rest of the human bodies. An intracavernous injection is in the penis or in the corpus cavernosum. That will get you points for erectile dysfunction. Question number 22. Teams off. Only one of these is actually a malignancy, others are not. Scotoma is a visual field defect. Condyloma is actually a non-malignant varicose growth caused by the papilloma virus, but non-malignant is a varicose growth. Mycetoma is a fungal infection, the mycetoma foot. Hamartoma is a benign overgrowth of tissue on its original site in the body. Coloboma is an iris developmental defect. Antibioma is what happens when a breast abscess is inadequately treated, it becomes a mass. Staphyloma is a scleral overgrowth in the eye. Cholesteatoma we already discussed in the previous question. Seminoma is the only malignancy here, so only seminoma will give you points. Any other answer along with this, you get marked incorrect for this question. Question number 23. What is happening in this video clip? So this is inside the body. It's a laparoscopic procedure. In the center, you see the uterus. On the right side, it is a tube that the surgeon is holding. He holds the tube and puts a ring around this tube. You can see the ring snugly fitting and blocking the tube. That's on the right side. Then the surgeon goes to the left side of the body and he does the same thing on the left fallopian tube. So what is happening here is a tubectomy or the fallope ring method or a fallopian tube ring method or a family planning procedure. Any of this will get you points. Question number 24. This was an interesting question. I showed you a game clip and I said, as per the FDA, it is the first of its kind. So let's have a look at the answer.
Imagine a medicine made up of pixels and play. Created with cognitive science and proven in clinical studies. A video game that's FDA approved.
That's what I'm talking about. Woohoo!
That invites your child to discover new worlds.
You did it! Nice!
Build their universe.
That question was tough.
Capture mystic creatures. Boost past challenges. And unlock new characters.
Oh yeah!
All to create positive change. Introducing Endeavor RX. The first prescription ADHD therapy
Look at us, rocking it again!
delivered through a video game experience. Designed to work alongside your treatment plan.
Hey, whoa! You were all round, and I was all woot! Awesome!
And proven to improve attention.
That was a video game. The answer is this is the first ever video game to be used as a prescription medicine. A doctor can prescribe this to you to treat ADHD. And well, there were some teams who actually wrote Endeavor RX in the answer. I salute you guys. I know you. I know who you are. I know how you got that answer. There were other teams who wrote ADHD. That is understandable, or have written that this is the first video game to be used as a medicine. All that is accepted. Coming to the last question. This is in fact not even Googleable, because this is a question that you can't find by Googling. All the very best. If someone can Google this and show me somewhere, anywhere on the internet or in any book, write down in the comments section, you might get a special prize. Yeah, some teams told us how much they love this question and tried their best to get the most answers. Let's go through it. Alpha, beta, gamma. You don't have any anatomical parts shaped like that. Delta will give you in the shoulder. It will also give you the ligament in the joint. Epsilon. Now coming to delta. Well, delta is the deltoid muscle that is shaped like an inverted triangle in the shoulder, and the deltoid ligament in the knee joint. Not many of you in the ankle joint. Not many of you got that. Then is epsilon, zeta, eta, theta, iota. A team wrote iota. No, my dear friend, iota is not because it looks like the letter I. That is different. This is iota, that is aorta. Kappa, lambda is lambdoid suture, like I gave in the question. Mu, nu, xi. Good number of teams wrote xiphoid process, but xiphoid is actually, it's like a sword. So xiphoid is not because it looks like the letter C. That is, it is not like that. Omicron, pi, rho, sigma. Couple of teams actually wrote sigmoid sinus, but not many. Sigmoid colon. Not many wrote sigmoid sinus in the brain, which is a dural venous sinus, also shaped like the letter S. So sigmoid sinus and sigmoid colon. Then you had tau, phi, chi. The X-shaped optic chiasma, like the letter chi, gives you a point, half a point. And perhaps the most difficult one, the one that I was really impressed with someone answering, is the letter epsilon that you see there in the bottom. Epsilon is the hyoid bone. In fact, it gets its name from the Greek word hyoidus, which literally means shaped like the letter epsilon. So you get 0.5 for every answer in this question. And if you have any other such, add them into comments. And all the viewers who are watching this quiz later, tell us which question you liked the most. Tell us what was your favorite question, favorite answer. Tell us your feedback about it. We'll be very happy to hear in the comments about it. Yeah. So now that we have come to the end of this live premiere of our answers, I hope you like the live premiere of our answers. Make sure you tell us what you feel about it. We spent a lot of effort making really good questions, finally crafting them, not making them too easy, not making them too difficult. So we want to give you the best experience, the most enjoyable experience possible with your partners. That happens at every OSMECON in the physical world. This is the first time it is happening in the virtual world. Second time, but the first time live in the virtual world. So with that, we come to the end. Like I said, the top 4 teams from here move to the finals directly. The next 20 teams are in the semifinals, semis A and semis B, 10 teams each. Top 2 from each semifinal go on to the finals. We will contact all the semifinalists and finalists shortly and explain the rules. We will have the semifinals live on Zoom. So with that, see you all in the finals, which is on the 30th of October at 4 p.m. We will have a live YouTube webcast with our chief guest, the very well-known Dr. Deepu Seben, the founder of Marrow. We're really happy to have him. So see you all there. Good luck, take care, and all the very best. May the best team win.